video number 3 from my chronic disease lecture. So the fundamental question is, how can something so divine and lovely that makes cakes and pies and gum and razzles and Skittles and bullseyes, a little like caramel candies with a little marshmallow middle, how can something so wonderful be so bad for the body? Sugar itself floating around the blood really doesn't hurt the body. If you were to look at a red blood cell, here's my little image of a red blood cell. Red blood cells will be coated with sugar. Sugar itself, glucose, can bind to fat and proteins in the body, just naturally. It's just chemistry, okay? For example, if you were to take a pot roast or a piece of beef or a piece of lamb, coat it in flour, and I apologize to my vegans, but coat it in flour and then burn it, what you're doing is binding the flour to the meat. So carbohydrate to protein, and that has a brown color. They actually call that in food chemistry the browning reaction. You can do that with heat, but it will occur on its own. So, when blood sugar levels are just fine, there's always a little bit of glucose covered around the body. When insulin is not working very well, or the person cannot make insulin, type 1 diabetes, blood sugar levels can explode, 250 milligrams per deciliter, 350, 400. And you get that sugar just ready to react. It will bind to everything. Capillary proteins, eye proteins, kidney proteins. In fact, if you were to look at red blood cells, they would be loaded in sugar. They'd be sugared. They'd be frosted, if you will. And that's an actual diagnostic technique. Doctors can measure blood sugar, and they do, but they can also measure how sugary the things in your blood are. So this is called the HbA1c score. Bio-Rad is a very, very famous company. If you go on Highway 680 in California and NorCal to the East Bay, from 80 to the East Bay, 80 to 680, there's actually a Bio-Rad facility over there. When they measure your HbA1c score, what they're measuring is how much sugar is on a red blood cell, because red blood cells last 3 to 4 months. So if your red blood cells, they take a blood sample, they look at the red blood cells, if they're sugary, that means everything is sugary on the inside. Blood sugar, the amount of sugar in the blood, that tells you how much glucose is in the blood at that time. That's not the same as the sugar for the last 3 months has been sticking to your body and doing damage. So HbA1c is not the same as how much sugar is in the blood. It's how much of that sugar has attached to your body. And so 6 and below is a good score. When you start to go up this score chart, doctors will worry that their patients who are above 9 are then actually doing damage to their body. And I believe this is correct. The risk of blindness increases as your HbA1c score goes up, because you're just sticking sugar everywhere, okay? So that's how this is happening. You are doing the browning reaction, if you will, inside your body. Not good. So then, can you stop this from happening? Type 1 diabetes, as of right now, there's no real way to stop it. It does run in families. There are studies where they try to push it off a little bit, but typically if one sibling has it, the odds that the other sibling will have type 1 is pretty high. Type 2 is different though. You can avoid gaining weight, especially belly fat. You can eat well. You can exercise. Think about where you store your glucose. Muscle tissue. If you want insulin to work well, give it lots of muscle to work with. So all those things can either help treat type 2 diabetes, or if you don't quite have it yet, but it runs in the family, hopefully push it off. Maybe you will get it and you'll be a lot older when you do. And then the way that we do this for any type of disease, not just nutrition related diseases, you have to get your blood sugar under control first. And for many type 2 diabetics, that means measuring their blood sugar, periodically going in for that HbA1c. That's the not sugar in the blood, but sugar that is attached to the body that was in the blood. Having that done periodically. If you can lose weight, lose weight. It's hard, I know. That means we're not spiking our blood sugar anymore. We're taking that glycemic index chart and we're going for the oatmeal and the beans and the nuts and the seeds and the whole grains. And then, yes, we are going to make our muscles part of the equation. They are going to suck up excess glucose that normally wouldn't get sucked up. If we can increase our muscle size, great. If we can use them more often and make them more dense and more physically capable, same thing. This is how you This is how you manage, you control your diabetes, or you treat it. Without going, obviously there's medication and things like that, but that's outside the realms of this class. So we measure, we monitor. You can't treat a disease if you don't measure a disease. Remember that. Somebody really famous said that. Steve Nissen at the Cleveland Clinic. Phenomenal, one of the country's best cardiologists. Then we worry about our weight. We go from the spiky diet to the plateau diet, right? Foods that plateau. And we try to make you don't want to increase your liver volume, right? But you can increase your muscle volume. That's the sponge that sucks up all the extra glucose. Okay, that's it for the diabetes half of the lecture.